Taking care of medically fragile children is a hard job, and even harder during a global pandemic. Reporter Julia Sandor explored how Arizona is going to be making a difference for families with medical fragile children in the future.
Arizona is one of the many states with a lack of nursing staff and resources because of the COVID-19 pandemic. With this lack of resources, Team Select Home Care is trying to change the pace and help families by giving them a chance to become a certified nursing assistant, or CNA.
So what this program does is it takes parents and family members of medically fragile children. It's not for every parent, it's not for every family member, and it's not for every child. This works better a little bit lower acuity children than the very severe high acuity children. But this program really can work for most families. And what it does is we will be able to take parents and family members, train them for absolutely free to become what's called a licensed nursing aide, an LNA here in Arizona. It's a special designation specifically for this program.
The course is 80 hours instructional training and 40 to 80 hours of clinical on-the-job training. This will help parents take care of their child while making an income at the same time. And it will help other nurses gain a stronger career working with high acuity patients. Some families think this program is going to take away some of the challenges they're currently facing.
It would help all of us a lot if we could make a living and stay at home caring for our kids as we want to. If we're working outside the home full time, we're also working inside the home full time.
The program in Arizona is more than 2 years in the making, and Johnson says it's been a bit of a struggle to get to this point.
But it really began with legislation that was passed and sponsored a few years ago, but the legislation wasn't quite written correctly to be able to do the program appropriately under Medicaid guidelines. So we had to sponsor the legislation a second time and get it approved a second time, which it was. It was signed off by Governor Ducey, who's been extremely supportive of this program.
He hopes that they can start training family members by the end of 2021. In Phoenix, Julia Sandor, Cronkite News.
Johnson says they've been doing this program in Colorado for almost a decade, and it has decreased the hospitalization rate of medically fragile children by about 90%. He hopes to do the same here in Arizona.